Hey guys, what's going on? This is Dr. Chad Coons, sports physical therapist, and actually a lot of people have been asking me about pain on the outside of the knee. So I figured, hey, let's just go ahead and create kind of a video that could summarize it. Let's use our anatomy friend here to kind of help summarize what seems to be going on. So the good news is that there's actually not too many different muscles, tendons, ligaments, or things that's actually causing that potential pain. So if we just stick to more muscular slash tendinous, if you want to look at it like that, number one cause is really an incredibly tight IT band, but it's not just the tightness. The tightness can actually contribute to an excessive lateral movement from your patella. So the patella will actually kind of move too far laterally, not really with just a tight IT band, but it could be argued that even like a tight kind of outer quad muscle, your vastus lateralis, could both be contributing to it. So a lot of times either the VL or the IT band are pulling on the IT band. I tend to find actually from a trigger point perspective where muscles are like really tight, this seems to be a keystone area that mimics people's pain. In fact, pain could even kind of be anywhere on the outside or even kind of run down underneath it. And the distal tendon quad muscle can actually be responsible for that. So in addition to that, you potentially could have a form of bursitis that's creating pain on the outside of the knee. The LCL is way over here, so the lateral collateral ligament, unless there was like a traumatic move where you got hit from the inside of the knee and it created a lot more stress on the outside, that could cause like an LCL problem. But guys, there isn't too many other things directly located there that could be causing our pain. So what do we do about a really tight IT band, and what the heck seems to be going on? Why is it so tight? So I'm gonna throw this out there. To me, it's actually really interesting. A lot of times people with really tight IT bands have horrible hip extension. So decent hip extension should be somewhere back here where the hip could extend, we'll say maybe 20 degrees. Unfortunately, that's a little bit more utopic. A lot of people don't even have that. In fact, just to kind of quiet down the IT band, I'm just looking for your hip to get down into extension or maybe a little bit past. What's the relationship between hip extension and IT band? Well, if you don't have good hip extension, I find that instead of the glutes doing the work, all right, which do extension primarily, it turns out that your IT band ends up trying to take the work. It tries to end up doing the work. So I think stretching your IT band or stretching your hip flexors in order to get more hip extension so your glutes actually do the work can be incredibly helpful. Along the lines of that, just to try to decrease overall tone, I think any type of foam rolling, lacrosse ball, soft tissue massage, anywhere along the lines can help kind of decrease more so neural tone to that area, kind of flipping a switch, decreasing neural circuits sent to that, and kind of incorporating more tone to the good stuff, which is going to be more glutes. And honestly, I would even be okay with, sending that tone to the quads and the hip flexors if you want to think of it like that. And then we've got to be mindful of what activity you're doing and relate that back. So a lot of runners have pain in the outside of their knee, and that's because when they strike, their knee goes in and their foot goes out. And that creates kind of an eccentric force on the IT band. It's kind of being consistently stretched, and it doesn't like that. It's going to recoil and it's going to kind of tighten up, and then you try to foam roll it and stretch it out all day long. But that's, may not be the problem. The problem is the way you're running. So in this case, learning how to strike better, ideally to me, through the ball of the feet, through the ball of the foot, the heel, will decrease the tone that's sent to the IT band, because it's not being consistently stretched out when you're running. Now, people ask me a lot of times, ice or heat. I tend to like heat. We're talking about a really strong, big tendinous and fibrous muscle. So I tend to like heat. If you want to get in a hot bath or even a sauna, that might kind of help calm things down. And for the IT band too, I think it's important to take a look at your feet. A lot of people with IT band problems have a flat foot. It kind of goes back to the same story I was telling you a little bit not too far ago, and this seems to be a little more common in women more than men. But if that knee goes in due to the foot due to the foot that's rolling in, again, it creates kind of that eccentric force here, and it can actually cause compression underneath the outskirts of your lateral under surface of your patella and the femur, and that can cause kind of some swelling that might mimic an insertional IT band kind of tendonitis, if you want to look at it like that. So that's just a little bit of a rundown as to what's causing pain on the outside of the knee. As always, guys, make sure you're solving the root cause of the problem. Make sure you're even kind of looking at the basics, like how is your posture? How does your standing posture look like? Making sure you're analyzing that well. How are you walking, right? Do you tend to be flat-footed on that side? Your foot goes in, your knee goes in. Walking can cause that. What's your hip mobility look like? Do you have enough external rotation in your hip? Do you have enough external rotation strength in your hip? Do you have hip extension? Is your core strong? Does that entire leg seem to be weak? Has it always been your troubled leg? Have you had any injuries on that side of the leg? I just want you to start thinking that there's a lot more questions that need to be answered opposed to just a simple, quick cookie cutter recipe to really kind of target pain on the outside of the knee. I hope that helped. If you have any questions, just feel free to comment below and I'd be happy to get back to you and solve that riddle. Thank you guys. Take care.